Dr. Pryor, who I just mentioned to you a minute ago, mentions that fibroids don't even bleed because they don't have a blood flow. So how is that contributing to your heavy bleeding issues?
Yeah, that's interesting. She says that because when you operate on fibroids, there is no blood supply. You can carve out a fibroid and lose very little blood. I've done it, I don't know how many times. So here's the thing that I will say that I'll piggyback onto her saying they don't bleed. If you look with transvaginal ultrasound, and I was famous for doing an ultrasound on every woman every year. They had a pap smear. I would do a vaginal ultrasound, not charge for it, take a picture, stick it in the chart. So I could see development of stuff from year to year. 75% of those women have fibroids.
Mm.
So, and that is held up by the data. There's a woman that wrote a book called Sex, Lies, and Uterine Fibroids, probably 20 years ago, who got really angry because her gynecologist took her uterus out because she had fibroids. And
Which
she
is
had,
what I'm sure there's some women listening to this now going, hold on, I got my uterus removed because I had fibroids.
yes, that's the number one pathologic diagnosis on a hysterectomy specimen. And what I'm telling you is if I take your uterus out and send it to a pathologist, they're going to look at the thing and they're going to say, oh, well, she has these fibroids. So then you can, as the surgeon, you can come back and say, well, we just caught it in time. You were getting fibroids and this and that and the other thing. And that, so if 75% of women have fibroids, to me, it would be abnormal not to have a fibroid.
Yeah.
So the fact that somebody has a fibroid was irrelevant to me. I'm not gonna say I didn't care. I'd say that has nothing to do
That's
with
not
the
enough
appearance.
reason to do it. Yeah.
That's not just because you have a fibroid, we're not taking your uterus out. That's what stupid gynecologists do.
Mm. What
The ones that
about the likes of then endometriosis or adenomyosis? Is that reason enough, or are there other solutions?